forgetting about their mics. Thank you everyone for being here today. Thank you Betty, Cam, everyone for organizing this terrific event. Although M3 is a biotech company and we're working on therapeutics for Parkinson's and Alzheimer's, I think there's a future for biotech and technology to collaborate to help improve the quality of life for patients with huge unmet medical needs. There are some, this is just a disclosure, that we have some forward-looking statements in this presentation. The main objective for M3 Biotechnology is to improve the quality of life for patients, not only extending the life, but help patients with Parkinson's and Alzheimer's to live a long and healthy life. Just an outline of what you guys are getting yourself into in this presentation. And to keep in the spirit of this panel, I'm going to focus on the technology that we're working on in M3, focusing on our lead compound, soon to be in the clinic in 2016, which represent affordable therapy that has the potential and is expected to grow brain cells, reversing and modifying the course of Alzheimer's and Parkinson's. We have a differentiated technology. If you compare it to other technologies in the clinic, we have a small molecule that goes into the brain and stimulates growth of neuronal cells. Also, I'm going to talk about our leveraged business model. Although in technology, you guys call it lean biotech, we call it capital efficient because you can't be lean in biotech. But we are focused on creating value as we move forward. MM201, our first asset, is targeting a unique growth factor. And just recently, by the Allen Institute for Brain Sciences, it was identified as one of the more, if not the most important target for brain activity and integrity. The good news for M3 is the group that has been working on, and I've joined 7 years ago, has been working on this technology for over 17 years, and we already have 7 patents issued around this target. MM201 is unique in that it addresses the entire volume of the brain. It goes into different brain regions addressing both cognition, memory, and motor function, and that's why we think, and we expected that it's going to be effective in both indication for Parkinson's and Alzheimer's. I have videos, the good news, but we don't have cool videos like that. First, we have rats and testers in the basement of the lab. So here, starting with Alzheimer's, we have 2 group of animals, and it's very interesting that rats, like humans, when they reach an age equivalent to 85, 50% of the rats will develop dementia. Meaning that they were not able to learn and forget stuff. Here, they hate water, so we throw them in water, we give them cues, and they should be able to read the cues and escape the water. The one on the right is the treated guy. He got MM201, and you can find that he directly reads the cues and finds the escape from the water. This guy is demented, has been trained as much as this guy, but did not receive the drug, and we can see that he's completely lost and doesn't even understand this test. A note here that this lucky rat was as bad, performed at the beginning of the study as bad as this guy. Basically, he stays swimming for over 2 minutes, and then we terminate the study. He can't find the escape. The second study that we did is for Parkinson's. Here again, don't worry about the naive guy, he's off the street. We did not age matched or treated or anything. He's completely naive to the test. These guys, they have Parkinson's. The middle one was untreated, while this guy was treated for 3 weeks. And they were both trained for 3 weeks. Again, the middle one is untreated, barely able to perform. The lesion treated is very comfortable, pull-ups. So we can see that the therapy actually improves both cognition, memory, and motor function. To date, we have several issued patents for MM201 and other therapies, and we covered also international markets. Moving on to the business model that we have, the capital efficient model and the history of the company. We are a platform focusing right now on our lead compound. Incorporated the company in 2011, and they don't tell you that biotech is really hard to fund initially. So we had to be innovative in the way that we look for funding. We created collaborations with the Michael J. Fox Foundation, Alzheimer's Drug Discovery Foundation, secured funding to help finish the animal testing and issue the patents. We've been selected as the Michael J. Fox, one of the Michael J. Fox Foundation partnering program. And I wanted to highlight also a local fund, Life Science Discovery Fund here in Washington State, that also helped us significantly in create traction. We were the first for-profit entity that gets the biggest matching grant that triggered an oversubscribed seed round. It was a very fast and easy seed round because of the traction that we got from the LSDF, Life Science Discovery Fund. The next stage is the future, what we have for the future. And I didn't think that I'm going to focus too much on this slide, but I think it's very suitable to the audience here. Because part of our development plan is we want to use data to help diagnose patients and look at the efficacy of the drug into the clinical trials. We want to use brain imaging studies to help identify the patient population that we're going to take in, that we're going to test in the clinic and see if the drug is effective or not. So here, and another thing in the clinical trials is we want to empower patients. We want to use wearable devices that are being developed to collect data and look how the therapy is helping the patients. Another unique thing in our business model, and partially it's because Big Pharma is closing their internal R&D, is we will be looking for a partnering deal with one of the Big Pharma groups that we are in conversation with. And they're becoming more active at a preclinical stage. This slide shows the number of partnering deals that happen between biotech and pharma at a preclinical stage, especially in CNS. Here, central nervous system, Parkinson's, and Alzheimer's is the biggest indication that pharma is pursuing today because of the huge markets. And I don't like to say markets because they are patients. Everyone, I think, is affected directly or indirectly by neurodegenerative diseases. The statistics are disheartening. Every 67 seconds here in the US, someone develops Alzheimer's. Parkinson's is not an old person disease. 10% of Parkinson's patients are younger than the age of 45. So both are huge, huge unmet medical needs. Another issue is in the pipeline for both Parkinson's and Alzheimer's, nothing has the potential of being a disease modifying that is affordable and accessible to everyone. It's not for select patients. Here we emphasize the Leen R&D, or the capital efficient, and M3 Biotechnology, a company based in Seattle. We cultivated collaborations from the east to the west to run all aspects of the drug development, including Swedish hospital where we're going to run our first clinical trials. Part of our leveraged business model is we use experts on as needed model. We don't want to compromise the experience, so we have an array of talent from consultants that are working with us to get our first lead into the clinic. The Michael J. Fox Foundation has been very for Parkinson's and Alzheimer's. Dr. Lance Stewart, who worked at the Institute for Brain Sciences, currently is a significant partner and component of M3 Biotechnology. At M3 also we recruited talent and business leaders as well as advisors that will help us achieve and cross the finish line. To summarize what we have a lead compound that is part of a technology, and we are targeting fast-track designation, breakthrough designation, that the FDA is genuinely trying to help groups that are working in this space to get therapies through the FDA obstacle, which is not now, I think. So we're working on novel technologies with novel commercialization paths.